Okay.
That's perfect. I don't really like the next commercial, so we'll stop sharing on that note. So yesterday we went over Medicare A and Medicare B. One thing I want to show y'all real quick is we're going to go back and I'm going to show y'all exactly where it's located. We're going to share screen. We're going to do screen 3 and hold on 1 second, guys. I'm sorry. Hey, Sarah, I'm in a meeting. Is everything okay? Are you okay? Is everything good or? Oh, okay. I'll be here for about an hour and I just started the meeting like 30 seconds ago, but I'll call you done, okay? Okay. Thanks, Sarah. Thank you. And
Hi,
that
Manny.
is I don't care. I don't really care if what y'all are doing. Hey, Manny, when a client calls, you always answer the phone. You can tell them you'll call them back in a little bit, but you always answer the phone. You know what she's calling me to do?
To get her Medicare?
Nope. She's calling me because she's got a referral and she wants me to come write them.
Nice.
That's what it's all about. Okay, so let's talk about here, let's get rid of that. And let's go to the playlist. Now this is, you know how to get to the YouTube channel, right? So if you don't, you go to medtig.com. Let's all just do it together. Medtig.com. That's our website, of course. You go all the way down to the bottom and you click on the YouTube channel and subscribe, okay? Subscribe so you can watch all these videos. So Original Medicare is where we're putting the training. Okay, so you click on Original Medicare and that's going to be the training from yesterday in full, okay? This literally is everything that we covered yesterday. Okay? So, youtube.com. This is where this is going to be. This is where that's going to be tomorrow. Okay. So let's talk about what we're going to recap what we learned yesterday. I'm going to play a short video right here. Ready? Go.
How does Medicare work? It can be confusing, but here are the basics. Medicare is the federal health insurance program for people who are 65 or older. It's also available to younger people with certain disabilities, people with end-stage renal disease and amyotrophic lateral sclerosis, also known as ALS or Lou Gehrig's disease. Medicare has Medicare Part A, hospital insurance, Medicare Part B, medical insurance, and Medicare Part D, prescription drug coverage. Medicare Part A and B are generally referred to as original Medicare. So to understand how Medicare works, let's talk about original Medicare. Original Medicare is different from other forms of major medical health insurance, like the health insurance most Americans get from their employer. It's different in 4 key ways. The first thing that is different about original Medicare is that it covers hospital care and medical care separately. Part A is the hospital insurance. It generally covers you when you're admitted to a hospital, skilled nursing or nursing home facility, or when you receive hospice care or covered home health services. Part B is the medical insurance. It generally covers medically necessary care that either diagnoses or treats a medical problem, like the flu in an outpatient setting, such as the doctor's office. Part B also provides care aimed at preventing or detecting illnesses at an early stage. The second thing that makes Original Medicare different is that it doesn't limit your out-of-pocket medical expenses. When we talk about out-of-pocket medical expenses, that means charges you have to pay yourself. Those charges include things like co-payments, deductibles, and co-insurance. One example is when you're admitted to the hospital, Part A has a deductible. After you're released from the hospital, that deductible can reset. Here's an example of Part B out-of-pocket costs. For approved medical expenses, you'll have to pay 20% co-insurance after you pay your deductible. For example, for a service that costs $100, you'd pay $20, and Medicare Part B would cover the rest. The third way that Original Medicare is different from other types of health insurance is that it doesn't cover prescription drugs in most cases. Prescription drug coverage is available through a separate program called Medicare Part D. Finally, the fourth way Original Medicare is different is that it doesn't have standard provider networks. What that means is that the amount you pay to see a doctor can vary depending on whether or not your doctor participates in Medicare. At eHealth, we hope that once you understand how Medicare.
Okay. Now I'm still in a couple of these videos just because they are so well put together and it's so easy to talk about after we watch these quick little videos. Now, yesterday y'all had a lot of questions about A and B. Why don't we hook it up and start a Q&A session real quick? Because I'm sure you wrote down a few questions that you have, and let's talk about it individually, and let's talk about let's just get it talking and get some of the questions cleared up. Who wants to go first? I know Manny. I know you're lined up. Can y'all hear me?
Yeah, we can hear you.
Yes, yes.
So who has questions about A and B?
I guess I have one question. If you're about to hit 64 and a half, but you're still working, maybe you plan to work up until 67, should you still enroll in Medicare Part A and B just to be in that enrollment period, or should you wait until your benefits are lost when you leave your employer at 67?
Well, you're gonna actually get logged into Part A at 65, but to sign up for Part B, as long as you have credible coverage in the coverage that you're happy with the coverage that you have at your employer, probably stick with the employer coverage from your job.
And Part A is automatic.
Yeah, when you turn 65, you're going to get Part A.
Perfect.
Everybody concur with that?
Yes. One thing to add though is that if they are insured through their work, what you can do is ask them how much they're paying, what the insurance is, how much they're paying, and you can possibly, because I've changed people even when they're working because they're paying a fortune for their health insurance. Some of them aren't even using it. So with that in mind, they take Part B, and I can put them in here at least one of the Advantage plans that don't cost anything. So they pay the $148, which is a lot less than what they're paying with their regular insurance at work. So sometimes it's better for them to change, but that's just investigation. You just have to take the time.
That's exactly.
That's a really good point. Really good point. Thank you.
No, you're welcome.
Brittany, come on, next question. I know you got one.
I actually don't have any right now.
Awesome. That is awesome. That's awesome. Manny?
I think Manny's reporting me for sexual harassment.
Okay, so that quick little video was a real good recap of how Medicare works. We have another one, and I'm just going to go over Part A one more time so that we can all be clear. Okay, these are quick little minute-long videos, and it goes over
We hear
what Part
often
A
from folks who
covers.
call in is, what does Medicare Part A cover? Great question. Part A, hospital insurance, generally covers you when you're admitted to a hospital, skilled nursing or nursing home facility, or when you receive hospice care or covered home health services. Part A benefits include inpatient hospital care, skilled nursing care. For the first 20 days, there is no cost sharing. From days 21 through 100, you pay a coinsurance amount for each day, and that amount can change every year. Part A also covers care in a long-term care hospital. In some instances, you may be charged a deductible if you're admitted to a long-term care hospital. Part A also covers certain home healthcare services. If you're unable to leave your home and require home health services from a nurse, you're typically not charged any additional cost sharing. And Part A also covers hospice care. Most hospice services are covered without any additional cost sharing.
So let me ask. Oh, well, we'll get in that later on. Okay, so we got that all handled on those two. I'm going to knock those two down real quick. Boom, 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 boom. Now, I know there's more questions that we have about Part A and Part B, but honestly, with the amount of people that we have in here, we can keep on rolling on and let the other people catch up, right? What did the big tomato say to the little tomato? I couldn't hear you.
Catch up.
That's right, catch up, catch up. Bad joke or dad joke? What day is it, Wednesday? Golly, time's flying. So let's move on into Part C and let's just talk about it a little bit, and then we'll move on. Okay. So I'm going to share the screen. Danny, would you read this for me?
Okay, what is Medicare Part C? Oh, wait, I have to move you guys. You're in the way. Okay. What is Medicare Part C? A Medicare Advantage plan like an HMO or PPO is another Medicare health plan choice you may have as a part of Medicare. Medicare Advantage plans, sometimes called Part C or MA plans, are offered by private companies approved by Medicare. If you join a Medicare Advantage plan, the plan will provide all of your Part A hospital insurance and Part B medical insurance coverage. Medicare Advantage plans may offer extra coverage such as vision, hearing, dental, and/or health and wellness programs. Most include Medicare prescription drug coverage Part D. Medicare pays a fixed amount for your care every month to the companies offering Medicare Advantage plans. These companies must follow rules set by Medicare. However, each Medicare Advantage plan can charge different out-of-pocket costs and have different rules for how you get services, like whether you need a referral to see a specialist, or if you have to go to only doctors, facilities, or suppliers that belong to the plan for non-emergency or non-urgent care. These rules can change each year.
Good. Now, Manny's always about credible sources. So this comes from hhs.gov. That's U.S. Department of Health and Human Services, okay? A great website to have stored in your bookmarks. They have lots and lots of stuff for seniors like Medicare and Medicaid, mental health and substance abuse, prevention and wellness. And it tells about, and you can even change the sizes for people just like me, blind. Right? Okay, so let's dig into Part C again. Like y'all understood what she said, right? So Ulysses, what did you get out of that?
What I got out of that was I kind of just referred to my initial question that Danny was able to answer. So in a situation where I do get a detailed outlook of what my client is currently using with their current employer, I could then assess if maybe a Medicare Advantage plan might be better, because maybe it's $20 or $30 a month, but that will still be better than the $140 that they're paying with the employer.
Right, so so their Part B premium is gonna be $148.60, which increases every year, so.
Oh, you love adding that dime to it. 148.50.
Yes, $148.50.
It's like $12, $15 a month.
No, it's 148.50 a month. It comes their, it's their
A month.
Part B deductible. They have to pay that. That's what the Medicare uses to pay these private companies so that they could do these no cost or low cost programs.
Got it.
So what most people don't understand, and I'm gonna kind of break it down for you, what Part C is individual private insurance companies administering the Part A and Part B benefits through plans that's approved by CMS instead of them being in original Medicare, Part A and Part B. Okay? Part C, I'm gonna say it again. Part C is individual private insurance company administering their Medicare benefits, Part A and Part B, through private insurance companies that has to be at least as good as, if not better, than original Medicare. Everybody gets that?
Got it.
Questions? Any questions? I mean, it doesn't matter, big or small. Okay, so if there's no questions, let's talk about Part C's programs. Like, so quiz time. What is Part C referred to mainly? Anybody?
MAPD plans, MA
Medicare Advantage plan.
Advantage. Yep.
Medicare Advantage plans. So if you have a Medicare Advantage plan, do you still have Part A and Part B?
No.
Mm,
What did you say?
yes. You do. You have to have Part A and Part B in order to get Part C.
Right, but you're assigning your benefits for Part A and B to a private insurance company. That
Right. But
the
you're
pro-
not losing them. So you
Never-
don't want to say, do you still have A and B?
Right. Well, no, that's a trick question. So everybody knows when Aunt Ethel says, am I going to lose my Medicare? No, you don't lose your Medicare. The private insurance carrier is administering all of your privileges to you and giving you extra benefits. Got it? That
Yes.
148.50 is actually being assigned to whichever carrier you are assigning them with. Okay. Now, what happens if we have a carrier that's giving back part of that money? Do they
Then
just
they'll-
do they stop charging him for it, or what happens?
No. So what happens is eventually it catches up with Social Security and they will then either not take some 148.50 out of the people's Social Security, or if they got it lowered to whatever it is they got it lowered to, they'll then take that amount out of their Social Security.
So what happens is with the most carriers, and I don't know if most people are familiar with it. Now, if they're on a Medicaid program, which is that deals directly with Social Security, that's when the money doesn't come out of the check. But on the give back programs, what happens is they're issued a check back from the company. Okay, back from the company usually.
Wait, you're saying that the people will get a check back from Humana or, okay, well, I know it doesn't work that way on the Patriot ones. Because
No, the
yeah.
Patriot actually goes hand in hand.
it takes it, yeah, it gets right out of their social security.
That's exactly right. But I'm talking about as far as anything other than the military back programs, how most of them are designed is to be paid back to the beneficiary. And that's just because that's their accounting stuff. Now,
Oh, I never had a give back program other than the whatchamacallit, Patriot one.
and the only
But
reason,
I could have sworn when I took the test right now, whatever it was for Humana, whatever, it said it didn't come back in a check. It said it came back through a social security.
talking about for the Patriot,
No, for all of them.
okay, I have to double check on Humana. I know WellCare is going to come back in the form of a check.
Okay, yeah, whichever one I just did, it might have been United Healthcare, as a matter of fact. That was one of the questions. So yeah, double check
I
because,
will. I mean, when we did the WellCare training, though, that's how they explained it to us. But
okay, I mean, because I want to know the right way. I don't want to tell these people the wrong way, so,
exactly, it's brand new to me too. So
yeah.
I mean, I'm excited. I'm excited that we're going to be able to have so many get back programs.
Yeah, I mean, they're awesome. Yeah.
Tia, what's your experience with that?
That it credits to the Social Security check,
Which company was that?
everyone that I've worked with, so Humana, United, and Aetna.
Okay. I will have that answer tomorrow, but that's cool. The WellCare guy said that they receive it back in a check. Isn't that what they said? I believe.
I've never sold WellCare, so that could be.
No, I mean, it's a brand new thing, and I've got one client on that actually down in Florida, so I could probably call and ask him. But that's cool. Now, what's the next question? Who wants to ask a question about Part C?
Okay, I'll ask one, even though I know the answer, but I'm just asking it to have the thing. So can these people have Part C and Part D?
Brittany, will you field that one for me?
Sorry, I'm in the process of getting my son ready for therapy. But the Part C, they can have a Part D, or they can have a Medicare Part C that has D included, right? Is that what she was asking?
She was
I was
asking.
asking if you have Part C, can you have Part D?
Sorry, I kind of got my hands full.
It's okay. Go ahead and explain it, Danny.
Well, MAPD right there, the prescription drug is in it already. So you don't have to have Part D because it's like an MA Part D, if you think of it that way. It's all together as one. With my experience, the MA programs, most of them, they have their own drug people, like the veterans. So you sell them an MA plan, but they have their own drug plan. They don't have Part D. They have their own. I think I was reading though that I don't know, there was one that you can get a Part D with it or a drug plan, but I don't know of which one that is because it's not one that I've actually sold. So it's I know Marcia wants to answer. She's back there all excited.
Sure, I have a question that I do. If you do you can do an MA plan or you can do an MAPD plan. But if you do the MAPD, do they have to have Part D through Medicare to put them on?
No, they get, that's the Part D right there. So think of it as MA, and I know PD stands for prescription drugs, but you could think of it as MA Part D. Boom. It's all together.
So let's just give a suggestion. Let's say January, I'm gonna throw a curveball at everybody. Ready? January 15th. They say, I've got an MA only plan, but I want an MAPD plan. Can they switch to an MAPD plan?
I don't think so. That's why.
I
No,
believe
no, they
they
cannot.
can only switch to regular Medicare.
Like to like, unless they're, no, it's MAPD, like an MA can go to another MA, or a PD can go to another PD. Unless there is an LIS period, a
Right.
SCP period.
Or they can drop it all together and just go back to A and B.
They can, but they.
Yeah.
Part D. So now let's go over this again, okay? October the 15th through December the 7th. Willy-nilly, whatever they want to do. If they want to sign up for an MA, they can sign up for an MA. If they want to sign up for an MAPD, they can sign up for an MAPD. If they want to sign up for a PDP and have original Medicare, they can have all that. Now, as many times as they want to between October 15th and December 7th, they can sign up with 27 different companies. But what happens on December the 7th at midnight? It's locked in.
Yep, their last company.
So with original Medicare, you have to have A and B. You do or don't have to have D
For
to get MAPD.
October 15th through December the 7th.
So
You
the
can-
Part D is not the Medicare program, that's the actual MA plan.
No,
No,
no, just listen to me, okay? October 15th through December 7th, you can get whatever you want. You can, this is Burger King. You build it your way, right? You can get an MAPD if you want. You can get an MA if you want. You can get original Medicare plus a prescription drug plan, if you want. Or you could just be on original Medicare and not have a prescription drug plan.
So
Okay,
I had a client that didn't have Part D
when?
here a few weeks back,
But you enrolled him in an SCP period.
right? And put them on a Medicare Advantage prescription drug plan.
That was,
So
Right.
they penalized for not having Part D?
no,
no,
put him under SCP period,
Okay,
which
Alright.
that'd be a much later date. That's
Yeah.
a much later date that we're gonna teach that. Because that's way more advanced than we're ready. We're just talking about Part A, Part B, and Part C general. We're not even getting into SCPs now. We're not even getting into deep diving into why we can do what we can, okay? I don't want to confuse everybody about that because that is very, very confusing. And if you don't understand the basics of Part C, then there's no way you can get into the deep diving of why we're able to do this during an SCP, during LIS, or during any kind of IEPs or any of those acronyms that I hate so bad, because it just confuses people. So let's start with, let's
well,
let's
so
build.
Marcia, to answer your question, Marcia, if you have MAPD, you do not need Part D, okay? Because Part D is built into MAPD.
thank you, Danny.
You're
That's-
welcome.
The MAPD stands for is Medicare Advantage Prescription Drug Plan, okay? Just so everybody knows, Medicare Advantage Prescription Drug Plan. But no, in January, if there's no SEPs, you can't take someone with just a Medicare Advantage plan and give them a prescription drug plan included. You can't give them an MAPD unless there's a special SEP that you can use. Okay? Okay, but we'll get into that much later. So, a Part C plan, is it an HMO, a PPO, a PFFS? Private fee for service is what that stands for, right?
Mm-hmm.
That's what Part C is, right? Original Medicare, is there a network of doctors it takes? Like an HMO and a PPO?
Are you talking about for Part C?
I'm
or
talking
original.
about for original Medicare.
Oh. The network of doctors is basically anybody that takes Medicare.
Boom, that's the correct answer. Anybody that accepts Medicare. Now, a PFFS is a private fee for service, which means what? Anybody that is willing to accept the terms and conditions of the plan can accept a PFFS. Okay? Which is another Part C plan. So what kind of, what questions do we have about Part C? Additional questions, not deep diving into the SCPs and special enrollment periods. I gotta stop with that, with the acronyms. What questions do we have?
So I've got a question. So there's Medicare Advantage plans that do not include drug coverage. Can they have Part A, Part B, a Medicare Advantage plan, and buy a standalone Part D plan?
Say that one more time so I can listen to it more clearly. I'm sorry.
So they have to have Part A, Part B to get a Part C plan.
Yes.
There's Part C plans, Medicare Advantage plans that do not include prescription drug coverage. Can they buy a Medicare Advantage plan and get a standalone Part D plan to still get the coverage?
And Brittany, is your question in reference to they have original Medicare and they don't want the Medicare Advantage, they just want the prescription part?
Say they
I'm
like the Medicare Advantage plan, but they don't want a Medicare Advantage plan Part D. Can they have a Medicare Advantage plan and buy a standalone Part D plan?
No,
It would be like four things.
no. They have to have, they have to sign, if they have a Medicare Advantage plan, they have to sign up, and they want a prescription drug plan, they have to sign up for MAPD.
Okay.
Through who they have the Medicare Advantage from. They can't go out and get a third party for the Medicare Advantage prescription plan. It's whoever the Medicare Advantage is from.
You can either have original Medicare and have a prescription drug plan, or you can have a health savings account and a prescription drug plan, but you cannot have a Medicare Advantage plan and buy a separate prescription drug plan. Is that accurate?
Yeah, the only time you can have a separate drug plan when you have an MA is, again, the veterans, when they get it from the VA.
Which is completely different than what we're talking about. The V,
But it's still an MA
Correct.
plan that's offered though. Yes.
but we don't offer it.
Well,
we don't offer the prescription drug plan. That's
right,
assigned by the Veterans Administration.
exactly. But we offer them the MA plan to choose from.
Yes,
Right,
exactly.
For veterans.
Yes.
right.
And veterans' wives. But that was a great question.
Thank you. That's what I thought. I just wanted to make sure. I just wanted to clarify because all those different acronyms are getting thrown around. So I just wanted to clarify.
Hey, can we sell MAPD plans to veterans that use the VA?
No,
We can only sell the MA plan, but not the prescription part.
Okay, so just Medicare Advantage, right?
Right. They have plans though for that.
Who has plans for that, Danny?
United, Aetna.
Oh,
the
gotcha.
carriers do.
For
Yeah.
the veterans. Perfect.
Right.
I got a question. So if someone has Part A, Part B, and Part D already, and they enroll in an MA plan only, what happens to their Part D plan?
Automatically canceled.
Yeah.
Okay.
Why would someone do that?
Good question, though.
They would just, I mean, they would just pretty much go into that carrier's Part D plan, essentially.
No. If they sign up with a Medicare Advantage plan and it's not a Medicare Advantage PD plan, then they would not have prescription drug coverage at all.
Right. So in the pretty much assessing, the agent would look at that they have a Part D, and they would pretty much enroll them into an MA PD. And that's it. Yeah.
Exactly.
Okay.
Exactly. And actually, when they charge, like there's such an array of charges for the PDP plans. Like some people pay $8 for, let's just say Bright Health. And then like my dad pays like $80 for Humana prescription drug plan that he had. And, there's such an array of cost in there. You're going to save them between $8 a month and $80 a month by assigning them a little to no cost MAPD plan to the carriers. I'm sorry, I've got another client calling. Hey, Linda, are you back yet? Yeah. Okay, I'm on a conference call. Are you okay? Here, you want to ask the entire group? You want to ask the entire group the question? Okay, here you go.
Maybe it'll help me.
Okay. Hey, guys, here's a real question from a live customer.
Hey, Linda.
Hey, listen, I need to find out from Cigna if my husband, how do I go about getting help for my husband? Meaning he has dementia, and I need to see if I can get some help in the house for my husband, like a few hours a day, or what do I need to do? Do I need to call him myself? What do I need to do? Is that a good question?
That's a good question, but we'll check on that as soon as I get a phone. It's not. I thought it was going to be like a medical question, not about Dallas with dementia. I'll call you. I'll call you as soon as I get done, and we'll work this out and we'll figure it out. Okay.
That is a medical question.
I understand, but I'm not going to talk about Dallas's dementia right now in front of everybody. Okay. I'm glad you're back. Did you keep your mask on?
Everybody's family in the office, isn't it?
Huh?
Oh my God.
You're on a conference call with California. Say, hey guys, this is my friend Linda.
Hi, Linda.
Hi, Linda.
I thought you was in the office. Brian, why you didn't say him? Oh God, Brian, give me a break.
Love you, Linda.
Bye, Brian.
Bye. Her husband just has been showing serious signs of dementia the last little bit, and she's a good client of mine. Okay, so Medicare Advantage, that's the kind of calls that you have to take right there, and you got to handle when they call, because they rely on you. What she really wants me to do is she wants me to call for her because she doesn't like being on hold. So what do we do, Chris?
Multitask.
We say absolutely yes, ma'am. I'll be more than happy to assist you.
That's perfect. Now, everybody, are y'all ready to do what we planned on doing?
Play games.
We're going to do that too. Ready? Happy birthday to you.
To you.
Happy
birthday to you.
Happy
Happy birthday, dear Christopher. Happy birthday to you.
Yay, finally reached puberty.
I hope that helped that hangover.
Oh my gosh, thank you.
You're welcome. Okay, so my dad's in here?
Yes, you told him to come to the 2 o'clock.
Well, I don't see him in here. Oh, he's probably in the wrong room. I don't know.
Yeah, he's not in here.
So so all good questions. All those are great questions that we're talking about part C. Now, yesterday I was a little, hesitant about moving forward just because I want everyone to have a strong basis on A, B, and C. Now, I really want to drive this point home. What is part C? Part C is private insurance companies administering beneficiary A and B benefits that have been assigned to them via the client, the 148.50, to administer all of their Medicare A and B benefits plus extra benefits. Got it? Now, that's pretty precise, right?
Right.
So is anybody unclear what Part C is?
I'd like to reword what you just said.
Okay, let's hear it.
So Medicare Advantage Part C is a private insurance company administrating, meaning that they are supervising and they're allowing you to use their facilities for Part A, Part B, and now Part C.
Because doesn't Part C actually include the dental, vision, and hearing?
That's the extra benefit that some carriers offer. Not all carriers, but some carriers may be extra benefits. Your Part C plan has to be as good as original Medicare. Okay? As good as original Medicare.
Brian, you didn't say if my answer was correct or incorrect.
I know I didn't.
Okay.
So
'Cause
that's
I can reword it again into a different word.
I want you to read this top sentence that I shared the screen.
Yeah. What is Medicare Part C? A Medicare Advantage plan like an HMO or PPO is another Medicare health plan choice for you may have as a part of Medicare. Medicare Advantage plans, sometimes called Part C or MA plans, are offered by private insurance companies approved by Medicare. If you join a Medicare Advantage plan, the plan will provide all of your Part A and Part B coverage. Medicare Advantage plans may offer extra coverage such as vision, hearing, dental, or other wellness programs. Most include Medicare prescription drug coverage.
Boom.
Medicare, okay.
That's how I want you to reword it, right there.
But so I have I want to build on that question. So and I don't know if Kaiser offers Medicare Part C, but Kaiser offers a lot of in-house options. So if you take Medicare Advantage through Kaiser, you then need to use the Kaiser facility for Part A and Part B. Do you have the option to use another provider?
Not with
Part A.
Kaiser, not with Kaiser. And Kaiser
Okay.
does have their Medicare, but Kaiser's a different
Beast in
animal.
its own? Yeah.
Yeah,
Okay, let's say it's Blue Cross Blue Shield. You have Part A and Part B through Blue Cross and Blue Shield. Can you go to a provider outside of Part A and Part B? I'm sorry, can you go to a provider outside of Blue Cross Blue Shield for your Part A or Part B
So let's talk.
wellness visits?
Let's talk about that for a minute. Okay. So like Blue Cross Blue Shield would have a Part C, okay, that are administering A and B. That's 100% true. But each one of these carriers, this is what you need to understand, like an HMO or a PPO. So an HMO is a group of doctors that work together to lower cost, right?
Yes.
So the Blue Cross Blue Shield label would be working in a group of doctors that accepts that HMO. Now, the PPO would be a group of doctors that accepts PPOs, which means you could travel out of state or wherever that's accepted. Okay? Do you understand what I mean?
I follow you. I understand the difference between an HMO and a PPO. For me, an HMO means like there's a gateway doctor that you have to go through the gateway doctor to see your specialist. A PPO means that you can walk straight to the specialist door and be seen.
right. But they're all under Blue Cross. You can't do it. They have
Correct.
to all be under the Blue Cross.
Under the list of providers, yes.
Yeah,
If you go to a provider that does not accept Blue Cross Blue Shield, can you be seen?
Not under a normal PPO, no.
Trick question.
You're getting into network and in network and out of network now.
Yeah.
Well, if you go and you have an emergency situation, they can't turn you away, right?
I was
Yeah,
gonna say, you
standard.
take it out of network, their costs are just gonna be higher.
Yes, right. But what your question was,
Can
is,
they go out of network, basically?
well, no, I mean, with an HMO, no. I mean, you go out of network, you're gonna pay completely out of pocket. If you've got a PPO, then you're gonna pay, you can go out, but you're gonna pay a higher cost. Typically, I don't
Right,
pat myself in a corner, but that's how it works.
One thing, Brian, I might have missed it in the beginning, or maybe we didn't review it, and I apologize if you did, but we didn't talk about any of the prices for Part C.
Yeah, we're going over basic C. We're not going over specific.
But okay, so the reason why I asked is for part A, we knew if you had this income, this was your cost. For part B, we knew if you had this income, this was your cost. Part C is based on what carrier you want to work with, or what
Yeah.
carrier you could afford.
There's some that are no cost. There's some that's $27. There's some that's $80. There's some, but the majority of the ones that we work with, there's no additional cost.
Gotcha. But so it's not necessarily standard, like part A, this amount, part B, this amount, part C is variable.
Yeah, part C is, it's based upon the formula that they have, that they need, and it's based upon the area that you live in.
Okay. Simple enough. That answered my question.
Good question. These are all great questions. And I mean, it's a little more advanced than what I was really planning on doing today, but it's good questions. And we got such a small group that it's great questions. And we just need to plow through this and get deeper and deeper every day. Yeah, but not too deep. Can't get too deep right now. So, before we close up, let's kind of recap what we talked about today.
Well, one last question before we close up, Brian. So we know what part A covers, hospitalized and anything that's inside the hospital. Part B covers doctor office and some wellness checks. Was there a list for part C and what it can and cannot include?
It's got to include everything that part A and part B original Medicare does. At least.
Gotcha.
Now, the benefit for part C is cap cost. Lower, understand? Original Medicare, there is no cap cost.
20% of infinity.
Right. But with a Medicare Advantage, you know there's a max out of pocket. It's called MOOP, M-O-O-P, maximum out of pocket expense that you can charge per year, okay? Maximum out of pocket expenses. Now, we're not going to get into plan specifics today because that's off limits, right? The reason is because we can go down that rabbit hole and talk for 2 days, you know?
Yeah, that's training on each individual product.
I mean, there's so many different plans for let's just take one state. There's so many different plans in each section of a state. So that's where, remember when we were talking about having 27 different states? The reason that we can't take on 27 different states on our first AEP is because you can't become an expert on the plans that you want to sell, right? You can't know, like on certain things, that there's a give back program on this program, or you can't know the actual details of that many plans. There's just too many. It takes time. So Danny, can you sum up what our meeting was about today?
Well, we talked about part C, the MAPD, and what MAPD includes, basically the A and the B and the D. It's all into one. And well, we mostly did talk about MAPDs.
Yeah, I mean, no, I mean, the whole thing, what I mean, what I want you to sum up is that we have questions about everything that from A to B to C. Tomorrow we might dive into a little more about C, maybe drill into each one of the different companies, just kind of give an overview of what
I think that's good because most of what you're going to sell is going to be C. Not everything, but most what you're going to sell is going to be C. So it's good to know. And good to know when you listen to a person which way to direct them. But we don't pick out their C for them. They'll pick it out. But we guide them to the companies and let them know what they offer. So we mostly do C, and it is important to learn about C, what it does entail, and why it benefits our beneficiaries.
Exactly.
That's a big one because again, you have to be able to tell them, like the person that's working and maybe is paying $400 a month for their insurance and they never go to the doctor. It might be okay to change them over to a plan they're only paying $148.50 to this year for, and then paying nothing else for their insurance. So it's just important to learn C, because you're going to be dealing with that a lot.
Exactly. And we're going to be doing some role playing pretty soon here. I haven't quite decided when we're ready for that, but, and I know everybody's like, I'm not role playing. Yeah, we're going to do some role playing, specific examples so that you know how to apply things, you know? And I really believe that if we practice things here, that it makes it a lot easier when we get to that actual situation. So I want y'all to write down some different questions that you have about Part C's, and just kind of think about exactly where your mind's going with this stuff. And then let's have some Q&A tomorrow about what you think about tonight. And look, Google is your friend. As long as you have credible sources and you Google questions, you're learning. And that's what this is really about, is your process of learning to become a Medicare Advantage specialist. Okay, you have to be professional in this job, and there's a lot of information out there. And I want what I really want for you is, when you have a customer, a client, and you give them information, that information, another agent can't come behind you and say, oh, that's not the best plan. Because if they do, they'll be lying. Because I want y'all to be able to find the best plan for the seniors and be able to offer it to them, period. I don't care which carrier it is. It's whatever that's best for the client. Now, I'm going to be sending out contracts for Brighton Health. That's an important contract there in California. What's the name of the company?
Brand New Day.
Brand New Day. There we go. I'm going to be sending them out. I might not get to everybody today, but you will be getting them the next couple of days. Okay. I actually have to do my certification on it. I called them today, and I have to do my certification on Brighton Health. But
Danny, I had, sorry, Brian, I didn't mean to cut you off.
Go ahead, Manny.
Oh, when she was saying that a lot of what we offer and what we're gonna, the clients will want is the Medicare Advantage. My question to Danny was, let's just say out of 10 clients, what percentage of them get the MAPD and what percent of them just get the MA? If you could just give me a ballpark guesstimate.
I'd say 99.9% get the MAPD.
The only people that don't get the MAPD are the military people.
Mhm.
Perfect. Okay, that clarified that question.
And Brian, I just want to say real quick to Brittany and Manny, thank you guys for always coming to the meetings. It really shows that you want to do this, want to learn, and I appreciate it. You guys are always in the meetings, and thank you for that.
We're just here to pick your brain, Danny.
Yeah, I have a little brain, so don't pick too much. I need it all.
Well, thank you as well. And thank you, Brian, and thank you, everyone.
Thank you, everybody. Happy birthday, Chris, again.
Happy birthday, Chris.
Happy birthday, stud.
Thank you. You guys are such a great team. Thank you for coming today.
Tonight?